And tonight, new safeguards are in place for workers at a high risk for contracting coronavirus. Good evening, I'm Joyce Taylor.
And I'm Jessica Janner Castro. Governor Inslee ordered the protections for older employees and people with underlying health conditions. King 5's Ted Land has more.
Working at a grocery store is not one of those jobs you can do from home. Across the state, thousands of people are still showing up to work every day, and now there are new protections in place for the most vulnerable of those workers.
This will guarantee folks over the age of 65 and those with compromised health systems the ability to get your job back when we get back to normal conditions.
Governor Jay Inslee ordered temporary emergency protections for workers who are most at risk of getting seriously ill from coronavirus. The new safeguards apply to workers 65 and older and anyone with underlying health conditions like asthma, heart disease, or diabetes. Inslee's proclamation requires employers to provide alternative work assignments, including remote work. If that kind of arrangement is not feasible, employers must maintain health insurance benefits for employees who cannot work. Companies are also prohibited from permanently replacing high-risk employees during the coronavirus outbreak.
Frankly, if we can wrap our arms, put a bubble around people of this ilk, of this age and condition, we're going to reduce fatality rates, well more than half.
I'm 70 and I have asthma and allergies. My store manager made sure the other day when I came in, I had a mask.
Renee Bushnell works at Fred Meyer and is in the United Food and Commercial Workers Local 367 union.
I don't know, how much more can we do? We can wear masks, we can wear our gloves, we can keep our social distancing. Those are the three primary things. If people did all of that, it would probably help a lot.
These new protections are in place until June 12th, unless the governor decides to extend it beyond then. In Seattle, Ted Land, King 5 News.
Some financial relief is coming to some small business owners in Seattle. The city has issued about 250 checks. The problem is there were more than 9,000 applications. The city used a lottery to determine where to send the $10,000 grants. Restaurants, preschools, gyms, and more were eligible. One West Seattle caterer says the money may have saved her business.
It gave me a lot of hope. It's making it so that Girls Gone Barbecue can be alive. I'm able to pay my rent and my business expenses, and the grant money it's made it so that Girls Gone Barbecue will be ready to open as soon as the governor gives the go-ahead.
Seattle Mayor Jenny Durkin says that she knows that $10,000 isn't enough for businesses to survive in the long term, but she's hoping it will provide some help until federal funding is available.
Today, the governor announced his plan to release some inmates early to keep them safe from the coronavirus. It applies to convicts with nonviolent drug and alcohol-related crimes and for those with 6 to 8 months left to serve, which means about 600 to 900 inmates will be released very soon. King 5's Drew Mickelson has a closer look at how it will work.
The details of these releases became public following a lawsuit filed here with the state Supreme Court on behalf of some inmates. Since then, we have seen protests, a prison riot, even demonstrations right here on these Capitol campus grounds. This past weekend, relatives of inmates called on the governor to release their loved ones from custody, saying it might save their lives. And those families do not think enough inmates are going to be released early.
We're scared. We want to come home.
Last week, offenders at the minimum security Cedar Creek Correction Center staged a peaceful protest at the prison fence. But about 100 up at Monroe got violent, damaging prison doors and mirrors, turning over tables, even threatening to take hostages after being told they needed to be separated after a half-dozen fellow offenders tested positive for coronavirus. Monday, Governor Jay Inslee announced that nearly 1,000 inmates will be released early and soon, and he revealed that may surprise their victims.
There simply is not time to do victim notification and negotiation to comply with the Supreme Court order. So these are emergency decisions. They are pursuant to order of the state Supreme Court, and we are moving as quickly as possible to be in compliance with that and what is good public policy.
In some more traditional governor's business, Inslee named Judge G. Helen Whitener to the Washington State Supreme Court. Justice Whitener has been a Pierce County Superior Court judge after working as both a prosecutor and a defender. She's replacing Justice Charles Wiggins, who retired from the bench after serving on the state's Supreme Court for 10 years. Speaking of the state Supreme Court, they are still practicing, they are still hearing cases and making rulings, but it's all being done remotely. In Olympia, Drew Mickelson, King 5 News.
Tonight, reaction from the Lewis County prosecutor and sheriff to the governor's decision. Lewis County prosecutor Jonathan Meyer said in part, quote, "While we remain optimistic those released will not commit additional crimes, historical data confirms new crimes will be committed." And then he goes on to say, quote, "The decision will add further stress to the already strained resources at the local level." Lewis County Sheriff Robert Snaza agreed and said in part, quote, "I feel the release of these additional offenders is of great risk to public safety." 2,500 Boeing workers began returning to work today, and most of them will be working on military aircraft. Workers are going to do their jobs in staggered shifts, and they're going to follow some very strict safety protocols. And they will receive some personal protection equipment to use on the job. Production was shut down March 25th following the death of a Boeing employee in Everett because of the coronavirus. Harborview Medical Center will now test all patients for coronavirus who are admitted into the hospital. Until now, the hospital only tested patients who were showing symptoms.
So what we're really trying to do is catch folks in that window period. When they're coming into the hospital, they're not symptomatic from COVID, but could potentially go on to develop symptoms in the next couple of days. And if we catch them ahead of time, we really have the opportunity to prevent any exposure to our staff here and any other patients.
And we should note the hospital is able to get test results the very same day. Most experts agree that moving safely beyond this pandemic will depend on testing and tracking. Chris Vanderveen shows us why it's so important.
In the midst of a pandemic, a virus too small to see has changed our lives in ways once too big to fathom. Yet if we are to get back to life as we once knew it, a viral game of hide and seek must end. Which brings us to the scientific equivalent of turning on a light, or in this case, a test, two of them. First one is one you likely know well, although probably not by its name, PCR, or polymerase chain reaction testing. It starts like this. Oof. Once collected, the cells on the end of that swab head to a lab where lab techs attempt to turn RNA into DNA with the help of enzymes. Don't worry, there won't be a test on that. Just know if you had the virus, odds are the PCR test will find it. But what about those who had it? Scientists call the second test a serological test. We'll call it an antibody test. Why? Because the test actively looks for antibodies in the blood. Antibodies produced to fight off disease. If you had the novel coronavirus, even if you didn't know it, you will have antibodies, and those antibodies provide a level of immunity. It's thought at least 1 in 5 infected with the virus don't show symptoms, but anyone with antibodies could go back to work, back to school, back to ERs or ORs without fear of infection. The more we test, the more we'll know what a virus too small to see has been up to. Millions of tests might be necessary, each to help us seek not just where the virus hides, but where it's hidden. The sooner we know that, the better the odds of us putting an end to this deadly game.
Chris Vanderveen reporting dozens of labs across the country are working on their own antibody tests. Last week, the Trump administration said it is working to make it free and widely available.
Governors from several states are working together on plans to reopen their economies. But today, President Trump said it's up to him to decide how and when it happens.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be.
He declined to say just how it squares with the Constitution, which leaves it up to the states. Right now, Washington State is working with California and Oregon on a plan to reopen businesses.